Well, Mark Ellwood is a travel writer based in London. He joins us now for more on all of this. Mark, we saw one company shifting gear there. What other segments in the travel industry overall have we seen doing similar things?
That's such an interesting question. I was thrilled when I traveled through Heathrow at Christmas, and I slept at the Sofitel while my COVID test took place, because hotels at airports are realizing it's a really efficient way for people to get tests. Check in, get your testing, it's ready for the moment.
The airlines, the industry itself globally has been really hurt over the last year. Those projections have slightly changed. What are we looking at going forward?
I think I'm sure you've seen airlines marketing the vaccination status of their employees. I was fascinated to see Etihad and Singapore fighting to be the first airline to say all of our employees are vaccinated, because that's part of this theatre of wellness, this theatre of health that the express testing sites are also part of, saying to us, look, we take health really seriously, and if we vaccinated our staff, we're probably trustworthy in all the other protocols we take.
Several airlines introduced social distancing on flights, skipping rows, skipping seats. Delta Airlines in the U.S., one of the ones that still spaces between seats. Other airlines have abandoned that. Why?
Money, as always. I think Delta is very smart to keep official social distancing in place, because those planes are not full. I've flown internationally to Tahiti, to Kenya, to the UK, and my flights have been largely empty. Domestically in the US, of course, there has been an uptick in flying, but those planes are still not at capacity. So why not turn the fact that you don't have as many passengers as you wish you had into a benefit for those who are flying? So the airlines were saying, look, I think we can cram people on board to make some more money. I say, kudos Delta, long-term people will remember.
In some countries that do have exit control at airports, the U.S. does not, we should note, but countries that do have them, this has really turned into a major civil liberties issue, whether flying is a luxury or if it's a right. How are we seeing that play out across the world?
Well, I think it's interesting. Most governments are delegating the controversy to companies and saying, we don't want to mandate testing, vaccination long term. We're going to let airlines take off. And Qantas and Air New Zealand both said, look, you're not getting on a plane unless you're vaccinated internationally that we operate. And that allows their government to dodge that. I also think it's a little disingenuous that all these civil liberties questions are bubbling up. If you travel to Africa regularly, which I do, I'm often asked to produce my yellow fever certificate. And local people in Mozambique, where I was most recently, saw people vaccinated as they landed if they didn't have the piece of paper. They're very aware of it. I think this new question is pushing this awareness to developed nations for the first time. And I think that adjustment is hard for them, but I think everyone needs to be a little less precious, because this idea has existed for quite some time.
Mark Ellwood, travel writer in London, thank you so much for joining us.